Hi everyone, Andrew Zhang Physical Therapy here, back with some more helpful back tips actually. Last time I gave you some of the top things not to do for your back pain. Today I want to give you 3 things you can do for your back pain to try to prevent it and overcome it if you do have it. Number 1, if you have a job that you sit for a lot, get up and move at least every 30 to 45 minutes. For most people with back pain, sitting can be one of the worst things that you do for it. Gravity sits on their shoulders, presses you down, and just makes people hurt a lot more. I hear a lot of people say, when I get up and move a little bit more and I'm more active is when I actually feel better. If you're one of those people, absolutely get yourself up and move. And this doesn't even necessarily have to be at work. It could be at home, if you're at a restaurant, even if you're driving. Get out of that car every so often and just move. It gets the fluids in your body going, helps the muscles to relax more. So that's important tip number 1. Number 2, daily exercise. Can't stress this enough. Every day we brush our teeth, right? Teeth are living things. What are the muscles in our back? What is the spine? Same thing. They need to be moved and to be used to help keep them healthy, to help keep them moving in the positive direction that you want, so that you live with less pain or live without back pain. Actually, that's a goal for everybody, right? Not to have pain. So you want to find a set of exercises, whether you do find some on the internet, whether a trainer gave you one, whether you came to a physical therapist like myself and gave you one. We gave you exercises for a purpose. Okay? Just because you feel better, don't stop doing it. You want to keep doing them and doing them, especially if they make you feel better. So find those 1, 2, maybe 3 exercises and just do them. Okay? Very important. Don't forget that. And number 3, if you do find something over the course of your day that helps ease your back pain, whether it's something that you figured out yourself, or whether somebody like myself, a physical therapist, gave it to you. It could be doing something like repeated back bends when you're standing, or it could be when you're sitting in a chair, you bend over to touch your toes. It could be laying on your back, pulling the knees to your chest, or even rolling your knees side to side when you're on your back. If you find something that works and eases your pain, do it often. Don't let that pain level creep up to 5, 6, 7. Get on it when it's maybe 3 or 4. Bring the level down to a 1 or 2. All right? Much easier to live and function when your pain or discomfort's much lower than when you let it get higher. Once it gets higher, it gets harder and harder to bring it back down. So to recap, get up, stand, move more. Number 2, daily exercises. And number 3, when you find something to help control your pain, do it often. This has been Andrew Zhang Physical Therapy. Have a nice day.